Anti-inflammatory medication. Are they safe?
Wow. All of our videos now are about, hey, thought it was safe, now it's not safe.
Trying to grab you before you swipe away from us.
That's right.
Welcome to Talking with Docs. I'm Dr. Paul Zalzo.
I'm Dr. Brad Ween. Today we're talking about NSAIDs.
Take 2 aspirin and call me in the morning.
Okay.
Nothing is more cliche than the aspirin in medicine.
And I think nothing is maybe, hey, maybe you shouldn't do that.
A
lot of people should not do that.
I think it's more of a can't live with them, can't live without them. Do you use anti-inflammatory sometimes personally?
Took one yesterday because I have Achilles tendonitis from pickleball.
Took one yesterday because I have a crick in my neck and I can't move it.
Welcome to middle age Talking with Docs.
Do you prescribe anti-inflammatories?
Yes. However, since we did our video with Dr. Pandya, our friend nephrologist, who is like, you guys are killing all my kidneys, I have definitely grossly dialed back the anti-inflammatories that I prescribe.
Same. I prescribe them for a short duration.
And then I say the family doctor should deal with it and keep an eye on the kidney function, blood pressure, stomach, all the other stuff.
Or even start and don't do them anymore.
Right.
And we do that a lot, because of post-op multimodal pain control.
Right.
So not only do we use them personally and not only do we prescribe them, but we're going to tell you about all the bad things about them because you need to know this if you're using them so you can watch out that none of these bad things or side effects are happening to you.
And this is over the counter and prescription. Neither are totally immune to them.
Right, and they are useful. They're not going away. We don't have a lot of options for pain control.
No, and that's what's gonna be some comments. Thanks a lot. Take away my Tylenol last week or my acetaminophen. Take away my NSAID this week.
And there's a global opioid crisis. You're done. You got nothing else for pain control. So they are going to be used. I'm still going to use them. I'm still going to prescribe them. But we have to be aware of these bad things that can happen when you use anti-inflammatory medication.
Okay, so let's start at the beginning. How do they even work?
Well, anti-inflammatory, non-steroidal anti-inflammatory medication just means it's an anti-inflammatory medication that isn't a steroid because we have steroids that can stop inflammation, right?
And we're not talking about like nandrolone or androstenedione. We're talking about things like prednisone.
Yeah, prednisone or cortisone or things that we inject. So those are powerful anti-inflammatories, but they have a whole host of side effects. You can't use them for long periods of time. So anti-inflammatories are much more appealing in that sense. However, they have their problems. So the way they work is they interfere with the pathway that leads to pain and fever. They interfere with prostaglandin synthesis, okay? And they do that by blocking some chemicals called COX-1, COX-2. They inhibit those, which stops the development of prostaglandins.
So cyclooxygenase, something that's, so COX-1 is kind of everywhere, it's ubiquitous, and then COX-2 is kind of induced.
Yes, and by blocking that pathway, we can stop these pain and fever mediators.
Right.
And they're not new.
Not new.
They've been around forever. Aspirin is like, I think it's the oldest medication perhaps, or one of them. It dates to Hippocrates, famous Greek physician.
Okay.
He found that the willow bark of a willow tree had these anti-inflammatory and antipyrogenic properties. So it can take down fever.
Chew on this.
Yeah, chew on this bark and call me in the morning.
Yeah.
Take 2 pieces of bark and call me in the morning.
Okay.
Said Hippocrates. So that's like ancient. And then ancient civilizations continue to use the willow bark, willow tree for these properties. And then sort of 1700s, 1800s, we started discovering some of the chemicals in there that are what's responsible for these effects. And then acetylsalicylic acid.
Yep.
ASA came out in sort of 1800s, and then 1899, Bayer, the German pharmaceutical company, trademarks it as aspirin.
Yeah.
And then there you go. From then on, it goes on, it goes on, it goes on. We don't really figure out how it works till 1980s. I think someone won a Nobel Prize for figuring out this whole COX-1, COX-2 inhibition.
Yep.
And then since then, we've been discovering the many uses of aspirin.
Leave a comment if you use an NSAID. Or particularly, we have a real key population who's going to say, I love aspirin. I grew up on aspirin. I take aspirin all the time. It's my go-to.
My God.
Leave a message.
Well, in the last 20 years, it's made a leap from stopping pain and fever to
maybe stopping cancer.
Cardiovascular benefits, right? There are indications. If you've had a heart attack, if you've had a stroke, you might be on aspirin to reduce the chance of another one. If you've had a cardiac stent, you may be on an aspirin to prevent
because of its antiplatelet effects through that pathway where it gets to thromboxane and prevents aggregation of platelets.
Yeah, you may be prescribed a low-dose aspirin after surgery to prevent a blood clot. So if you're prescribed it, keep using it. That's what your doctor told you to do. Keep using it, but just be aware that these are some of the side effects that can happen.
So when it comes to NSAIDs, we would say that they're good at acute pain relief
my God.
and controlling inflammation.
And preventing secondary events after heart attack, stroke.
Right, but the danger is with taking either too much of them or them for too long, or in a vulnerable host. So as we get older, as we accumulate chronic medical disease, if we are taking multiple medications, even if we're consuming alcohol at the same time, these all can, or dehydrated, these can increase your risk of taking normal medications.
Right.
Okay, so let's talk about the most common complications. There's really 3 big systems, but there's a whole bunch of them. We're not going to do a complete list, but we're going to go with the big 3.
Okay.
So when people think about NSAIDs, what am I worried about? What are you worried about as a physician?
All right. The first one that comes to my mind is peptic ulcer disease.
Right.
That's just the first one that comes. Getting a GI bleed, bleeding from your stomach because of an ulcer, that is directly correlated to NSAIDs.
And chronic users are in the range of like 1 to 2% lifetime risk. Like it's not negligible. It's very real.
Yeah. So, and a gastroenterologist will tell you that taking NSAIDs is going to increase your risk of an ulcer or a GI bleed.
There was a study that said people that were scoped, that were taking NSAIDs regularly, that even asymptomatic ulcers was in the 15 to 30% range. Like it's not uncommon.
Okay.
Yeah.
So that's probably the first one that comes to my mind.
Yeah, and so it's not just peptic ulcer disease. It can be gastritis, so you can have just irritation of the lining of your stomach, or even dyspepsia where you have heartburn, as well as lower GI bleeds. So if you have somewhere in your body, even like a polyp that is borderline friable, sometimes that can start to bleed, or your hemorrhoids can bleed more because of this. So you can have upper and lower GI bleeding, but the GI, generally speaking, are not very happy. And what I would say is that if you talk to a gastroenterologist, their favorite amount or favorite NSAID is no NSAID.
Fair enough.
But
I feel that. Like if I take an anti-inflammatory for more than like 2 or 3 days in a row for whatever, I get an upset stomach.
Sure.
So I know I can take it like for 1 day and then wait a week or something before I take it again.
And part of that is because the COX-1 helps form mucus that lines the stomach to protect it, it's a protective barrier. So ways that you can deal with this if you have to take an NSAID for a short period of time would be a couple different things. One, consider a COX-2 specific one. So that group has reduced the risk of ulcers, not to zero, but drastically reduced the risk of ulcers. Taking it with food, that's probably the second one.
Yeah, and low dose.
Yeah.
If you're on an anti-inflammatory for prevention of a secondary cardiovascular or cerebral event, so to stop another stroke or to stop another heart attack or because you have a stent, that's its low dose. That's like 81 milligrams. That's a subtherapeutic dose when you're thinking of pain control or fever control.
Right.
So there is, because some of these effects are dose dependent, those are much safer because you are on those sometimes for life, right?
Yeah.
But they're such a low dose that the risks are reduced.
One other thing I would say that you could consider, your family doctor might consider adding, is a PPI. So a proton pump inhibitor added to an anti-inflammatory that's not a COX-2 can reduce your risk of an ulcer.
So that's GI.
GI, which is a big one. Okay, GI.
What's the next one you think
Number
of?
2 is the kidney.
Yeah.
Shout out to Dr. Pandya, one of our colleagues. So
They take a
the
beating.
nephrologists say, hey, the NSAIDs do damage to our kidneys in a bunch of different ways. So one, could be a potentially direct toxic effect because of its effect on prostaglandins, which helps regulate the blood flow that goes in to the kidneys, as well as nitric oxide production that dilates our blood vessels. So the blood flow to the kidneys is compromised, so your creatinine can go up, your eGFR can go down.
And with kidney disease, what happens? But you can measure. You might measure on your own, and you can check while you're taking anti-inflammatories. If it's happening to you, your blood pressure.
Yes.
Just measure your blood pressure every day if you're on one. You can get a blood pressure cuff and just check because you may see that start to creep up as an indication that you're experiencing a side effect from your anti-inflammatory.
Right, so if you have borderline kidney function, or certainly if you have kidney failure, your nephrologist is going to say, my favorite NSAID and the favorite amount of NSAID is none.
0
If you have to take it for a short period of time, again, lowest dose possible, shortest frequency, stay well hydrated. There's no evidence that any of the NSAIDs are particularly safer for the kidney necessarily.
Okay.
So there goes your kidney. So
Renal.
yeah.
Okay.
Last one, big one.
Cardiovascular. Right? You need your cardiovascular system to
Yes.
function, to live.
Right.
And there's a lot of evidence in the literature that suggests that anti-inflammatory use is harmful to your cardiovascular system.
Right.
And this is a super duper catch-22 because we're telling you, or you might be prescribed an NSAID because of your cardiovascular system.
Right.
Yet at the same time, the NSAID can do harm to your cardiovascular system.
Right, it's because of where it acts on that pathway.
Yes.
So, I mean, aspirin as opposed to the other NSAIDs.
Right. aspirin, the benefits of aspirin are, when you're using it for your cardiovascular system, are the anti-inflammatory properties and the antiplatelet properties to prevent a clot that can lead to a heart attack or a stroke.
Right. And what's very interesting, I think this, pay attention if you take baby aspirin. So what I learned is that if you take certain NSAIDs, like ibuprofen and diclofenac, they actually interfere with aspirin's ability to irreversibly bind to the platelet and affect its COX-1. So this could negate some of the benefits of your aspirin. So if you have to take Advil or diclofenac and are taking aspirin, you need to take it 8 to 10 hours later.
Wow.
Or the other option is don't take it.
Chew on a willow bark?
No, a cardiologist's favorite anti-inflammatory, if you have to take one, would be naproxen because it does not interfere with aspirin platelet binding.
We should ask our cardiology guest next time.
Yeah, I should get Dr. Heffernan on.
Ask him about naproxen.
Yeah, for sure.
Okay, so GI, renal, cardiovascular. Those are the systems that can be affected by anti-inflammatories.
Right. Okay, so you have to use one though. How are we going to figure out a safer choice within NSAIDs as well as outside of NSAIDs? So you got pain, you got some inflammation. Within NSAIDs, we would probably say GI side, COX-2s are going to be safer.
Yes.
Right? If you have specific cardiac issues, you're probably going to have to consider naproxen. Again, discuss this with your specialist, obviously.
Yeah.
And if you have severe kidney disease, probably no NSAID. So then we're going to go down to other options for pain control because people are like, chronic pain, now what are you doing to me? You're taking away my NSAID.
Yes. Well, you could consider a topical NSAID,
Right.
so a preparation in a cream or something where you can rub it on the area
Yes.
if you're taking it for musculoskeletal pain.
Right. The only way that you can run into trouble with a topical is if you put it on such a large amount of your body surface area that the absorption got to a problematic. This is anecdotal. There have been a couple case reports, but this is not essentially a recognized risk. So topicals are very, very safe, thankfully.
Right. Otherwise, consider another agent like acetaminophen, and then watch our acetaminophen video where we told you all the bad things that can happen with acetaminophen.
Right. Potentially a nerve agent if that's within your scope, as well as even CBD now, I'd say is making a bit of a push to say, well, hey, maybe we're not the best at pain, but we're pretty safe. So there's a bunch of things around that you have to consider, and it's complicated. We acknowledge that it's very, very complicated.
Yes. And someone's going to type, hey, what about this headline I just saw with possible prevention of dementia? Ooh. Well, yeah, there's a scientific article that just came out.
Okay.
We'll give you a link to it here that looked at NSAID use and the prevention of dementia. They followed a large group of people over, I don't know, over a decade.
Yep.
And they divide them into short-term, intermediate term, or long-term. And long-term is over 2 years of NSAID use. And they found, yes, indeed, that did look like it decreased the incidence of dementia.
Right.
Maybe because of the anti-inflammatory properties, inflammation in the brain.
Association, not causation. It's not an RCT.
Yeah, it's not a randomized controlled trial. It's not proven, but maybe it may inform some future studies or future drugs that may help prevent dementia because we know we need something to help prevent dementia or treat dementia.
And it may because you're having little kind of mini strokes. Theoretically, that's one of the possible mechanisms because of its antiplatelet properties. Maybe that's what it is. It's thinning your blood a bit, so you're not having those little mini strokes. We don't know.
Yeah, but that might be one of the future uses of anti-inflammatories. These things have been around for centuries, all right? If you're prescribed it for a certain reason, keep taking it.
Yep.
But just be aware. We recognize they work well. We use them, we prescribe them, but there are risks of side effects, and we just want you to know about them so that you can be aware if that's happening to you.
So now proceed with caution with anti-inflammatories. Not that they don't have a role, but you need to be careful. And if you like this video, please like it. Subscribe to our channel. Check out our podcast over on Apple and Spotify.
Yeah, just imagine the podcast. You can hear all this glorious information without having to look at these mugs. You are in charge of your own health.
See you next time.